One of the things that I've been told very frequently by physicians is that patient demand is actually a very important part of what's causing a lot of physicians to adopt this. Would you say that that's true in your experience? Or
I think demand from the patient side is important, particularly when a new technology is just developing, because as the technology develops in any particular country, the first patients that are going to be using it for are going to be patients who are actively seeking it out more or less. And so that demand certainly drives the beginning innovation. And it, of course, continues. I mean, if patients are coming to your clinic saying, hey, I want RFA, of course, it's going to make you more likely to try to adopt that as a physician. Depending on your reimbursement models, too, of course, that plays a role as well. But patient demand, for sure, is certainly part of what drives anything in healthcare, realistically.
Yeah, and RFA is really a kind of a poster child for patient-centered treatment of disease processes, right? We traditionally, and in fact, Dr. Grogan and I, we take out lots of thyroid. We do lots of thyroid surgery. That's what we do. But we also are just hyper-focused on patient-centered interventions. And, you can't talk to someone who's an experienced thyroidologist and without, being open about, once someone's permanently hypothyroid, there's different changes that occur in the body. We know that thyroid cancer patients have significant drop-offs in their quality of life.
Right.
We don't understand exactly why, but we know that happens. And so the concept of patients wanting to have thyroid-preserving interventions should not be novel to anyone who's an experienced thyroidologist. Where this really hits the sweet spot is that, we're able to do high-quality interventions in a thyroid preservation manner to meet the medical goals of therapy or the surgical goals of therapy while meeting the patient-centered goals for quality of life.